I'd like to talk about another subtype of fibromyalgia as I have discovered in my practice using functional medicine paradigm, again from the Institute for Functional Medicine. There's toxicological fibromyalgia. What does that mean? Well, let's talk about Sally. So Sally was a postmenopausal woman, and she had been diagnosed with fibromyalgia by another physician and came to me, and she said she had fibrofog, which is a term I really don't like, but it's used, which is basically cloudy thinking. And, the diffuse muscle pain, which is characteristic of fibromyalgia. So I did testing, nutritional deficiency testing, and she had very high levels of lead. Now, the fascinating thing about that is that you can be exposed to lead in your younger years. And because chemically it has some similarities to calcium, it can go into your bones. So you can actually store lead in your bones. And lead, of course, is neurotoxic. And it can stay there in the bones for years and years and years. But then what happens is when a woman becomes postmenopausal, and by the way, men have a similar condition called andropause, which is when their testosterone and DHEA levels drop. But with women, when their estrogen levels, progesterone levels drop, which is the onset of perimenopausal and postmenopausal syndrome, the bones go from osteoblastic, or laying down of bone, to osteoclastic, or breaking down of bone. And this is why postmenopausal women and elderly men get osteopenia or osteoporosis at a far more rapid rate than premenopausal women and younger men. And what is osteopenia and what is osteoporosis? Is a demineralization of the bones. The calcium starts to leak out of the bones. Well, now we get back to the story of the person that has lead in their bones, and what happens? The lead starts to leak out into the bloodstream and becomes toxic. So when I discovered the high levels of lead in this patient, we did chelation therapy. And chelation therapy consisted of certain chemicals that grab the heavy metal, in this case lead, and get it out of the body. Now, these chelation agents, they don't distinguish between heavy metals and minerals. So they will also leach out the good stuff with the bad stuff. So whenever you initiate chelation therapy in a serious way, the person has to supplement with the minerals. But this is what we did, and we did it over a period of months. And her symptoms of fibromyalgia became much, much better, especially her fibrofog, which was really, I think, lead toxicity. And we repeated the levels after a few months of chelation therapy, and they had dropped down into the normal range. So she was a happy camper.